Hey, good afternoon. I'm glad that you have joined us today. Thank you for being here for the broadcast. This is a great opportunity for me to be able to talk to you and tell you all some things that are going on here. It's also a great chance for you to ask questions. I would appreciate it if you have any questions. Please call in or email those in, and we'll be happy to talk about whatever you want to talk about. We have just a few things that I want to go over, and then the discussion can kind of go wherever you like. Happy International Women's Day, first of all, to those of you who celebrate that. That's an important day, and so we want to recognize that. I want to let you know that we're making plans to come out to the districts and visit with folks in the county health department. I've been cooped up in the building here, it seems like, for about 6 months, and now I have a little bit of time freer. More available to me to be able to do that. So I've been working with Ricky Elliott on a plan to do that. We hope to start doing that just in the next few weeks. And ideally, I think we would like to try to find a couple of county health departments in a district, 2 or 3 perhaps, that we can come out and visit in a day or so and give people at different locations a chance to talk and ask questions and allow me to meet people and get to know people. There's many places that I don't know well and a lot of people that I still would like to meet, so this is a great opportunity for me and I'm very excited about it. It's not meant to be some big event where you shut down your clinic and we stop everything, but rather just something informal, just to give me a chance to get to know people and sort of learn the things that you're thinking about and the things that you're interested about. So let me tell you a few of the things that are going on here. As you know, our legislature is still in session. That's something that consumes a lot of time, particularly on the days that they're physically here in Montgomery. So we've done a lot of work back and forth on a lot of different bills and a lot of different issues that are pertinent to the health department. You may know that the budgets are working their way through. They're working their way through the committees, and we hopefully will have some ideas about where the budget looks soon. It looks as though we're going to be, for the most part, level funded, and that's a win in most years. There are a couple of items that are going to be added that we believe. We do think we're going to have increased funding for our prescription drug monitoring program, the PDMP, and that was a real priority for us. That's a big part of our opioid initiative that we've been working on as a way to address the crisis that we have in the state. You may be aware, but the prescription drug monitoring program is used to record every opioid prescription that's prescribed or dispensed in the state, and that information is available to the prescriber boards who have that and to law enforcement. And we're just now going to be able to actually get some access, statistical access to de-identified data, not personal health information, but data that will allow us to use public health tools to get a better understanding of what the opioid epidemic is. So improving the PDMP costs money and requires a lot of effort on a lot of people's parts, and so it looks like that's going to be funded, and we're very excited about that. There's also an expectation that we may get some funding for infant mortality issues. That's something that I have worked on quite a bit since I've gotten here. Infant mortality is not my natural background. It's not the kind of medicine that I practice, and so it's been quite a learning curve for me to kind of understand that problem. I think have always understood the importance of that problem, but really haven't understood the details of it. So I've spent a lot of time trying to dig into that and to understand that. We have a great group of people here who've been working on this for a long time, and so I think we finally may have some resources and be able to make a difference in that. Infant mortality in Alabama has for a long time been a big problem. It's not new now. We haven't just discovered this. We've been near the bottom of the heap for a long time in dealing with that. But we do have great examples that we can see from other states around us of ways that we can make a difference and interventions that we can make. And so we're just now hopefully getting the resources to be able to do that. So that's actually very exciting. Some other things going through the legislature that people often want to know about is a cost of living increase. That's very exciting for state employees. It's been a long time. There is a 3% COLA that's traveling along with the budgets. We don't know how that will turn out, but so far so good, and we'll certainly let you know as soon as we know more about that. Just a couple of other items to mention. EHR is on the horizon, and that generates a lot of excitement, positive excitement, I hope. But EHR, of course, means change, and change can be difficult, but we can see on the other side of that, we're going to be very excited to have a first-rate electronic health record, which is going to make it so much easier for us to take care of our patients. I've experienced EHR transitions in practice before I came to the health department, and I can tell you it's a difficult, challenging time, but ultimately it just makes you better able to take care of the people that you want to serve. So we're very excited about that. We have Lori Stout and some EHR experts in the room. If you have questions about that, we'd be glad to bring them up on stage and let them talk about that. If our pilot program goes well, which we hope it will this month, then we'll begin the rollout of that in the Southeast region starting sometime in April, we hope. So that's how it begins. The EHR videos are available on the LCMS, and so I would encourage you to take a look at that. I hope that supervisors will give your staff time to spend with that and look at that and try to get as much information as you can before that rollout actually occurs. We are going to begin looking at our 6-month budget roll-up soon. We're trying to get information on how we've been doing for the last 6 months. We don't always have real-time data, as you know, and so it takes a little while once we get our budgets done in the fall to sort of see how things are going. This will give us an idea of sort of where we stand, if we need to make any additional changes, if we have additional resources available to us. So there are a lot of things that we can learn from that, and you'll be hearing us ask questions about that soon, trying to get more information and just try to get a better idea of where we stand. Once we know what our budget situation is like for this next fiscal year from the legislature too, that'll give us a clearer picture. The budget process is new to me, at being new in this role, so still have a lot to learn with regards to that. So I'm very interested though in seeing where we look and if our budget projections are holding up, and how we're gonna function as an organization. Those are most of the items that I wanted to cover with you today. It's a fairly short list, I guess, that I wanted to bring up, but I do want to give you an opportunity to ask questions if you want to do that. In the meantime, I'll just mention one item that I wanted to let you know about. One of the things that I've dealt with recently has to do with sanitation issues in Lowndes County. It's a long-standing story that we've heard about for a long time that's attracted a lot of national and even international attention. It's a real difficult issue because you have a county that has a lot of poverty. You have people that can't always afford adequate septic systems. And this has reached the point where we've had visitors from the United Nations here investigating this. We've been written up in international newspapers. Most recently, we had National Geographic Explorer here to shoot a documentary about that. And it's been really instructive to me to sort of learn about the idea of how the environment and poverty and sanitation issues are closely linked in many ways. You have a really vulnerable population. You have a group of people that don't have a lot of resources, in many cases don't have a lot of education, and don't have the social capital to deal with those problems. And our Environmental Bureau has worked very hard to try to remedy those situations. Sherry Bradley and her team have all done a great job, and I really appreciate what they're doing to work with local leaders there. We've had the U.S. Congresswoman from that district in the area, and have talked to her extensively about plans to try to address that. And so I just tell that story because it's been a great one for me, and kind of in my own personal growth. It's just been a way of interacting with people who have real problems, who have really difficult situations, who are coming to us at the health department and saying, can you help us? Can you please give us some relief from this situation? So it's challenging and it's not easy, and it won't be done soon, but I've really sort of relished the opportunity to get involved in that. And so that's just one interesting story I wanted to tell you. Anyway, that's all I wanted to discuss with you directly, but I'll be happy to answer any questions if we have any. And I'll just sit here awkwardly until somebody asks a question. Okay, no questions. Anybody in the audience have anything they want to say to the world? Or okay, everyone's looking around the room, and now they're all looking at me. I want to say something that I say just about every time, because I really mean this. Thank you all for what you're doing. I really appreciate it. You know, I have a position where I get to interact with a lot of people and sometimes get credit for things that I don't deserve credit for. But those of you who do public health every day and have been for a long time are the people who are making a difference in the lives of the folks we take care of. And I just want to tell you I really appreciate that. Thanks so much for what you're doing.